Typically, there's no slowing down Gracelyn Guyette. So when she came into the house looking cold and pale and couldn't move her arm after taking a fall, her mom Crystal knew something must be seriously wrong.
I think that's what concerned me most as a mother, is your child is just kind of like listless, and her eyes seem kind of distant.
After examining an x-ray of her arm, doctors at an urgent care clinic sent Gracelyn to the nearest emergency room, Asante Rogue Regional Medical Center in Medford.
This is very severe. They're like, this is really, really bad.
Hospital records listed Gracelyn's admission type as emergent severe or life-threatening. The then 5-year-old had suffered a broken elbow at the growth plate and required emergency surgery. She needed to be airlifted immediately, the hospital explained, because no pediatric orthopedic surgeon was available locally.
Why couldn't they treat her here?
They didn't have a doctor that was insured. It was an insurance concern to operate on a 5-year-old.
Hospital staff made arrangements for an air ambulance to transport Gracelyn from Medford to Portland, a roughly 50-minute flight, avoiding icy roads and any possible delay.
It would feel odd as a parent when all these doctors are telling you she's got to go by air ambulance now, to be like, nope, wait,
Photos from February 25th, 2022 show Gracelyn being loaded into a small plane. The air ambulance, operated by Mercy Flights, flew Gracelyn and her mother to Portland, where she underwent emergency surgery at OHSU Dornbecker Children's Hospital. The procedure was effective, and soon Gracelyn returned home to Southern Oregon. Then, the bill came. The insurance company, Anthem Blue Cross Blue Shield, expected Gracelyn's family to pay the full air ambulance bill, nearly $60,000.
It's mind-boggling and it's infuriating that this can occur.
The insurer was willing to pay for the ambulance on the ground, to and from the airport, but not the airplane. According to its denial letter, Anthem Blue Cross Blue Shield determined that Gracelyn's air ambulance ride was not medically necessary.
There's nothing that I can possibly think of that we would have done differently in this situation, and yet, here we are.
The family appealed, as did the air ambulance provider Mercy Flights. But at every turn, Anthem Blue Cross Blue Shield denied their claim.
Every time we appeal, I think, okay, they got to get it right this time.
And Gracelyn's family isn't alone.
We got this $60,000 bill in the mail, and we're like, this is strange, we have insurance.
Our station in Denver, KUSA, has reported on other families facing hefty air ambulance bills after their insurance claims were denied.
$60,000, and their insurance company, Anthem, said it wouldn't pay.
You're just floored. You're like, seriously?
Earlier this year, a group of ER doctors wrote to federal health officials saying they've seen a spike in denials of claims, often involving air ambulance bills. The reason? Doctors say the No Surprises Act. The federal law intended to protect patients from unexpected medical bills. Insurers can get around the law if they determine care is not medically necessary, and insurers themselves get to decide what that means.
So there absolutely is a major problem going on that's affecting more and more families.
We emailed Anthem Blue Cross Blue Shield in late November. 9 days later, a spokesperson responded, explaining, "We did not originally receive the necessary medical information to justify air transport, but after receiving more information, the claim was approved."
What's your reaction?
We're thrilled. We're very happy.
Anthem Blue Cross Blue Shield wouldn't say who failed to provide the necessary medical information. Both the hospital, Asante, and the air ambulance company, Mercy Flights, declined to comment.
The appeal that we sent that they just approved was identical to what was sent before. So it was maybe a new set of eyes that looked at it. But I think certainly the pressure of having media on them is really probably what made this get approved.
Gracelyn's parents say the bill felt like a dark cloud hanging over their family finances. They're relieved to have things cleared up. They just wish it hadn't taken so long.